Just want to see the symmetry of your body.
It's like down here.
Okay.
And then like down this way.
Into the butt.
Yeah.
Okay.
And then down my leg.
Okay. Yeah.
So yeah, but then if there's like the middle back pain, it's always like right around, I think right around here.
Okay.
Yeah, right, probably around here too. Yeah.
So right in this area?
Yeah.
Okay. And then you feel pain kind of like through the left side?
Mm-hmm.
Right here. Okay. When you feel the pain, you said you feel it sitting is pretty bad, right?
Yeah.
So do you feel it right now?
Yeah.
You're sitting?
Mm-hmm.
Okay. Okay. And on a scale of 0 to 10 right now, today, how's it?
Right now it's probably like a 4 or 5.
Okay.
Yeah.
Okay. What movements aggravate it? Like,
If this leg was going, like this leg I can go up,
okay.
but I can't go farther than like right here with this one. So.
Got it. Even when the other leg is down?
Yeah.
That's
about as far as I can go, and I feel it right here.
Okay.
Yeah, like right here. It just feels like it's pulling all the way up. Yeah. And
Where does it feel like it points to?
right here.
Okay.
And then the back underneath right here too.
Okay.
And a little right down there on the side.
So more on the outside.
Mm-hmm.
Okay.
I've noticed it when I'm like driving. I have a stick shift, so I obviously use both legs to move.
Okay.
And so I think that's where like my hips are like
stick shift. Yeah. That's probably gonna...
moving and twisting. So I definitely feel it when I'm driving.
When I bend like that, is that painful?
Mm-hmm.
Where is it painful?
Right kind of where your hand was.
Okay.
Yeah.
Okay. So how far can you bend back before that starts getting painful?
Right about there.
Right there?
Yeah.
It's like right here, right?
Mm-hmm.
Do you notice your shoes wear differently on one side to the
Yeah.
other side? Because you got a lot of rotation in your pelvis.
Yeah. I never noticed that until like now though.
Your pelvis is doing that and you're leaning to that side.
Okay.
So, yeah, I mean, and it's been going for such a long time because you have so many compensations.
So that means like when I'm walking it like, that's why it wears weird?
Yeah, yeah. Okay, come on back. Yeah, so your left foot is swinging inwards, so that's why your shoes wear really differently on one side to the other side.
Okay.
Something right here. Is this sensitive when I roll over right here? Yeah. I'm seeing a big inflammation marker over here, so I'm gonna guess right over here, right? Yep. Okay. Sorry, I'm not gonna do that too much. It feels like that's a little tender too.
Yeah.
Yeah. Okay. So basically, what I'm feeling is this hip is rotated outwards, right? And so what it's doing is it's spraining this joint a lot. So that's why it's so tender. There, you're jumping. I know. Basically, so this is rotated out, and what I'm seeing when I'm looking at your spine is this whole sacrum. So this is basically this big triangular bone that goes here all the way to close to your tailbone, right? So it's actually popped out over here. So if we look over here, like it's more popped out here than it is over here.
Okay.
So basically it's causing some of the rotation up. When I look at the measurements on the x-rays, it actually is not a huge difference, but I'm looking at you and I'm feeling, I can definitely see it. Yeah, so it's not exactly what I thought it was going to be, but looking at you, it's pretty obvious. Okay, so what we're going to do is we're going to be adjusting the sacrum that's rotated backwards, forwards. Okay? You can do it. Good.
Yeah.
Yeah.
I felt that.
Okay.
Yeah.
Okay. Come on up.
It feels like a little looser, I guess, maybe.
How's that feel?
Not quite as bad.
Just a little bit more. There we go.
Yeah, that one definitely felt better.
Yeah. Come on up. Are you doing?
Yeah, it feels like lighter. I don't know how to explain it.
Okay. So this one's going to feel a little different, okay? So I'm going to try to guide you down. So you're just going to relax a little bit more. Good. How's it feel?
I feel like that was a little higher than before.
That is higher than before.
Yeah.
Okay. Good. Okay. That's definitely more symmetrical.
Okay.